welcome you to HDFC Ergo's Health for Happiness session. Yoga can do more than just relax your body and mind. For those living with diabetes, it may help in its management by lowering the blood sugar level. Along with certain lifestyle changes, practicing yoga asanas every day can help with diabetes management.
Let's start Dandasana. Stretching the legs out in front of you. Pull the skin of the buttocks and sit on your sitting bone, keeping the spine, shoulder, neck erect and gaze ahead. Draw your navel in. Push your heels out, toes pointing the ceiling. You can also move the ankles and the feet to ease the tightness around the joint and sit for about 3 breaths till comfortable. To connect with the breath while keeping the body at ease helps in the improvement of the flow of blood with the right amount of oxygen flow too. Relaxing the mind is very essential to keep one away from all kind of ailments. Given the blood sugar disease is very common, this practice becomes important. Paschimottanasana. Moving from Dandasana, inhale in 3 counts. Stretch the arms above your head. Keep attention on the frontal body and back straight. Exhale in 3 counts. Bend forward from the waist, stretching your arms forward. Press your mid-thigh down, heels and calf muscle down, and try to touch your chest on the thigh and head to the knee, keeping the spine straight and elongated. Toes are curled in, and you can hold your toes with your fingers. You can lower the elbows here and push the elbows out, opening the chest. You can also use a block if you're not able to go down. Remain in this position for 6 counts. With every exhalation, try to extend your back. This pose, begin with the releasing of unwanted indigestion, helps to also improve the functioning of the digestive system. Hence, pressing the belly as close to the thighs requires some practice, and it can be done using the breath intelligently. Inhale and exhale. Now when you inhale, return to the starting position, keeping the elongation of the spine. Janu Shirshasana. Sit up and stretch the legs out. Inhale. Bring the right foot on the inside of the left thigh. Now inhale 3 counts and raise the arms above your head, and while exhaling in 3 counts, bring them forward along with the torso and reach for the left foot while resting the face close to the left thigh. Seated here in Janu Shirshasana for 6 breaths, make sure the stretch is felt both at the lower back and the hamstring. The idea of practicing this pose is more for the digestive system and abdominal organs. Hence, don't push yourself to become flexible here. This pose with the belly pressed towards the thigh activates the pancreas, helping in the production of insulin. Now release Ardha Masendrasana. From Janu Shirshasana, sit in Dandasana. Now fold your right leg inwards. Press your heel against the opposite thigh without allowing your knee to lift up. Take your right leg, bend it at the knee, and place your right foot near the outside of the left thigh. Now bring your right knee close to your chest. Bend your left knee inward to place your foot close to your right hip. Let your left hand hold your right ankle or toe, grasping the foot anywhere comfortable in such a way that your right knee comes under your left armpit. Inhale from the chest and exhale, taking the torso in a twist towards the right side, gazing behind. Placing the left elbow on the outside of the right knee, bring the head on the right shin. Now place the right hand on the floor behind you close to the hip, while taking the shoulder and chest in a gentle twist in this lovely posture of Ardha Masendrasana. Sit here for 6 breaths, taking the twist deeper with every exhalation. Make the pose comfortable by breathing slow and deep, and remain here closing the eyes. Release and stretch the legs while going into the pose with the other leg. This pose with the pressure at the belly induces the digestive system, while also using the abdominal muscle and the chest muscle to go deeper into the pose. Balasana. From Dandasana, bring the legs bending at the knee and sit in Vajrasana. Take few breaths and stretch the back upwards. Now inhale and interlock the arms behind you at the fingers and pull the arms downwards. Stretch the chest out and shoulders behind. Inhale and raise the arms behind you, and as you exhale, take the torso forward, pushing the belly and the chest close to the thighs while placing the forehead on the floor in bound low yoga mudra. Going down here in the forward bend gives an extra advantage, ensuring the digestive system with the various organs like kidney, liver, pancreas, intestine are put to work. The pulling of the arms helps to take the spine forward while also expanding the chest and heart, ensuring the improvement in the circulatory system. Slowly, as you inhale, come up. Pavan Muktasana. From Dandasana, lie down in Shavasana. And inhale, raise the legs up, bending the knees. And as you exhale, press the knee against the chest in Pavan Muktasana. With every exhalation, press the knee close to your chest while keeping the neck and shoulders relaxed. Be here for 6 breaths and stay with slow, deep breathing technique. Pressing of the abdominal muscle here while the breathing is slow ensures the functioning of the various organs related to the abdominal area. Release and repeat this for another round and stay longer this time. You can now relax in Shavasana for a few minutes.
Thank you for joining me in HDFC Ergo's Health for Happiness session. Your health is in your hand, so start working on it today onwards.